Welcome, Dr. Katrin, to our SV Talks podcast. You've escaped for a moment from the German veterinary clinic, which you founded 17 years ago now. So GVC was the first ISFM cat-friendly clinic, fear-free accredited practice, and zero pain practice in the Middle East. And as of recently, you've become one of 8 double board certified veterinary psychiatrists. So congratulations on that.
Thank you. Thank you so much. So my name's Dr. Katrin Jahn. I'm a veterinarian. I've been a vet for over 25 years. I own and run the German veterinary clinic in Abu Dhabi, which I founded in 2008. So 17 years old now. And I'm also the owner of Trinity Veterinary Behavior, which is a global online platform that is an educational platform on all things veterinary behavior medicine, also known as veterinary psychiatry. And I am a double board certified specialist in veterinary behavior medicine.
So what made you decide on veterinary as a career, and where has it taken you so far?
Yeah. So I'm one of those people who wanted to be a vet ever since they were little. So I think I was probably 10, 11, 12, I think, when I decided I wanted to be a vet. And a lot of that was to do with growing up around pets. I was a keen horse rider when I was a little girl. And I always had a very scientific mind. So that whole idea of marrying my love for animals with the sciences and biology. And I was also always that kid that whenever there was a vet that came to the riding stables, when I was kind of that age, I was literally fascinated. And I would follow them around, just kind of follow behind them, and they'd be taking x-rays of horses' feet and getting all the bandaging stuff out. And it was just I was just fascinated. So yeah, it was a very sort of clear career path for me, I guess. But obviously then once you actually become a vet, it's quite incredible how many different opportunities can open up for you. So you can either go into general practice, and there are so many different types of practices out there. You can specialize, you can go into industry. So there are so many routes, I guess. And for me, it was always a very clinical career, I guess. I'm a clinician at heart. I love clinics. I love being in clinics. I love working with the clients. I love working with the pets. But I did realize I think once I opened GVC, I realized that we're amazing as an industry at taking care of the physical health of our pets, but we haven't traditionally been so great at taking care of their mental and emotional health. And that's what led me to specialize in veterinary psychiatry. So yeah, that's something that I finished early this year. So my first exam was at the end of last year, and then my second exam early this year. So yeah, that's where it's taken me.
So can you tell us a little more about what it means to be double board certified?
Yeah, it's a great question because it's quite fresh at the moment. So that whole transition from being a resident to being a specialist has been quite interesting, I guess. So I've really had to think about what it is that I want to do with my specialism. I think we do have a responsibility as specialists to increase the standards of veterinary care in our communities, in the countries that we work in. So that's something that, through things like this, doing podcasts, educating, I've got quite a few speaking opportunities coming up. That's something that definitely is part of that. But I think also just being an excellent clinician. So one of the things I did during my residency was actually spend time with other specialists, so neurologists, internal medicine specialists, dermatologists, and just watching the way that they worked up their cases is on a whole different level, I think, than when you're practicing as a general practitioner. And obviously here in the UAE, we don't really have any referral practices. So it is a little bit of a different way of doing things. And that can be challenging at times from a client education point of view, letting them understand what are the different options for them out there. But yeah, so it's a whole new realm that I'm entering into, even at this kind of slightly later stage in my career. But yeah, I love it. It's both daunting and very exciting at the same time.
That's a very good way to put it. So what did you have to do to complete your journey? And how long has it taken?
Yeah, so the residency, most traditional residencies are around 3 years in length. This one was a little bit longer because I did what's called a non-conforming or a non-traditional residency. So I wasn't based at a university, which is what most residencies are. I essentially designed, with the help of my mentors, my supervisors, I designed my own program. And there are a number of different things you have to work through. So one of the big things is you have to see 400 clinical cases. So that took quite a while. It's quite a big number of cases. You have to design and execute your own original research. You have to write and publish a case report. And then there were a number of other things. So as I mentioned, shadowing neurology specialists, dermatology, internal medicine specialists, just because that's such a big part of behavior medicine as well. Attending international conferences. So the whole thing, I started in the summer of 2019 and it ended in January 2025. But then there was obviously COVID in the middle. So I think that probably took away a year, not being able to travel and not being able to do some of the things I had to do. So yeah, 5.5 years, essentially. Yeah.
Wow.
Yeah.
It just goes to show your dedication.
Yeah.
So what does your qualification mean to clients or pet owners, and also your former vets?
Yeah. So to the pet owners, I think it hasn't changed massively because I started building the behavior service at GVC when I started my residency. So I've always been offering veterinary clinical behavior consultations. I guess now, just as a result of all the learning that I did for my board exams and, the experience that I was able to gather in those 5.5 years, they now get a very accomplished psychiatrist or a very accomplished behavior clinician, which at the beginning, wasn't the case. Obviously, you learn as you go. And veterinary behavior medicine is something that we're not really taught a lot about at the university, at vet school. So it was essentially a whole new sort of topic, a whole new area of veterinary medicine. And I feel I'm close to 500 cases now in total. And I feel that, it's maybe the last 250 cases where I really think, okay, there's obviously still a lot to learn. Every case teaches you something new, but you feel confident in your abilities, I think. I think the other thing that my clients get is my ability to look at both that mental and emotional piece, but also the physical health piece. Because there's so much crossover, especially around chronic pain, skin disease, GI disease. There's such a huge influence, bidirectional influence. So, behavior affects physical health and physical health affects behavior. So it's being able to look at that case in a really comprehensive way. So I had actually a case 2 weeks ago now, a dog that came to see me for a behavioral presentation. So anxiety, was really worried to leave the home, really worried of the outside. And while I think there absolutely was a behavioral component to that, this particular patient had really severe dental disease, so a disease called CUPS, so canine ulcerative paradental stomatitis, I think is the name for it. So a really painful mouth, an inability to fully open the mouth. And of course, that has to have an effect on behavior as well. That's going to, I think, compound any kind of anxiety that might be there as a separate issue. And so my advice to that particular client was that we need to make sure that we get on top of the dental disease at the same time as we address the mental and emotional disease. So it's seeing that, I guess, big picture and being able to almost kind of case manage some of these really tricky cases. And I've always said, so I've been a vet for over 25 years, these behavior cases are by far the most complex cases that I've seen in my entire career. I've seen a lot of really, complex cases, but they're so multifaceted and multifactorial. So you've got the owners, the caregivers, then you've got the environment, you've got their sort of early life history, then you've got physical health. It's just really layered. And I love that. That's what I really love about these cases, yeah.
That fuels your passion.
Yeah, absolutely. And I think in terms of my vets, so did you mean like the vets at GVC at the clinic or which vets did you mean?
So this is more for your fellow peers.
Okay.
Yes, so vets in general.
In general. So part of my other company, so I have a second company called Trinity Veterinary Behavior, which is an online global platform, which is essentially an education hub for other vets and pet care professionals. So vets, vet nurses, trainers, non-veterinary behaviorists. So there's a lot of education there. So I actually have created 3 courses already: Learn to Speak Dog, Learn to Speak Cat, and Psychoactive, which I know we'll be talking a little bit about. So there is an educational piece. I also offer vet-to-vet consults. So they're 30-minute consultations if I have vets that are perhaps struggling with a case or they're not sure what medications to choose. So we can do a 30-minute vet-to-vet consultation where I can support them. So I think that's a really nice thing to do. And I love that. That's probably like my favorite thing to do, is actually be able to collaborate and support other vets in some of the cases that they're seeing in their practices. And then I think for my own vets at GVC, they obviously have watched the whole journey, so they've kind of gone through that journey with me a little bit. But there's so much that we do as being a cat-friendly practice and a fear-free practice. There's so much that we do in practice that's quite different. And so I'll oftentimes WhatsApp with them or chat with them about, medication protocols, whether that's pre-visit pharmaceuticals, which we use a lot of, or, then they might refer the case on to me if it's a dog that's really been anxious at the clinic or something like that. So, yeah, I think it's providing just a point of contact and just a point of being able to brainstorm and throw some ideas around for both the vets that work at my clinic, but also the sort of wider veterinary population, I guess.
And what are misconceptions that you hear in practice? Well, and in the veterinary grapevine, which is quite a big grapevine.
Yes.
So what misconceptions have you heard with regards to animal behaviour?
So I think two big ones come to mind. So I think the first one is still this idea that the way that we treat our patients in the veterinary setting. So I think a lot of the time we're very task focused as vets. So we kind of want to get the job done. If an animal, let's say a dog comes in for a vaccine and they're obviously very uncomfortable, defensive, struggling with the ability to cope in that very sort of high pressure setting. I think there still very much is a tendency to just get on with it, just get the job done. And then we have handling or restraint that is inappropriate. The whole idea of kind of pinning them down or scruffing cats to immobilize them just so that we can get a job done. I think that is still quite prevalent. And, I think paying more attention to their emotional needs in that moment, because it's going to have long-lasting effects on what they learn in that situation. So what happens the next time they come back to the veterinary clinic and they've learned from that previous not-so-nice experience? What does that then mean for their welfare for future vet visits? So I think that's one big thing. And then the other big thing that we're still struggling with is the whole idea of aversive-based training methods, so punishment-based training methods, shock collars. I've heard some quite incredible stories in my 5 years of building my behaviour practice here in the UAE of caregivers that have very well-intentioned gone to other professionals to seek help, and then the help that they've received has actually made the situation worse because we've had methods that have been applied that have just been totally inappropriate. I mean, I've heard of dogs being helicoptered, which is kind of swung by their leashes or extremities to get them to behave. I do know of dogs that have had shock collar treatment here, and those unfortunately then become the cases that become really difficult to treat because the dogs are they don't trust anyone anymore. They're just shut down, and it's really difficult to come back from that. So I think that whole kind of dominance theory or alpha theory, which is a massive misconception and a huge myth, that definitely it's being busted. I think in most of the circles I move in, we're all very aware that that's not a thing anymore. But I think there are other circles that is still a theory that is entertained or an idea that is believed to be true, which it is not.
And following on from that, can you share any misdiagnosed behavioural problems that have been either brought to you or that you've experienced yourself?
Yeah, absolutely. And I think this goes back to the physical health piece. So I've had a lot of patients where they have been perhaps referred to a trainer to help address a behavioural concern, but actually there's been something underlying such as chronic pain. And no matter how much you train or how great the training is, you can't train away pain. It's just not a possibility. So I think a lot of the misdiagnoses have been around that, and that's why I always say we need to be, we as vets need to be involved in these behavior cases because we have to rule out all those physical contributions first. So that was one. Another really interesting one I had actually was, this is a few years ago now, a cat who was urinating outside the litter box and, had tried so many things, gone onto the internet, Googled and all sorts of things, and wasn't able to solve the problem themselves. And as it turned out, the cat was actually blind, so was suffering from bilateral, as it ended up being glaucoma. The cat ended up having one eye removed because it was so painful. But because the cat was blind, it couldn't find its litter box. And then the caregivers, in trying to do the right thing, kept moving the litter box to different locations because they thought, oh, maybe this is not the right place. So the cat was all the time like, where's my litter box gone? And so some of those things are really interesting when you see them unfold as cases like that. So I think those would be my biggest things, just where we haven't been aware of the physical health contributions to behaviour.
And can you share some of your behavioural aids that you use in your treatment plan?
Yeah, absolutely. So I love talking about this. So veterinary behaviour treatment plans are really complex. So just like we would with pain management, we would always employ a multimodal approach. So it's never the one thing, usually it's never the one thing that kind of fixes the problem. It's usually a very comprehensive approach. And we always design treatment plans together with the caregiver because they have to be realistic, they have to be implementable. The caregiver has to be able to actually do the things that we recommend. But some of the things that are part of most, or I would say almost all treatment plans, are environmental management. So that could be as simple as shielding the animal from some of the triggers it finds really difficult to deal with. It could be some safety management pieces if we've got aggression in the home, for example. With cats, we always want to optimize the environment. So we always go for the 5 pillars of a healthy feline environment according to our ISFM guidelines. So environmental management is a massive piece. And oftentimes just by shifting the environment, we can get, such quick wins and big improvements. It could also be, for example, if a dog continuously barks at the doorbell or barks at something that's moving by outside, just by putting some frosted glass stickers over the windows or disabling the doorbell, that can be a really quick win situation. Behavior modification, so essentially training or teaching the animal to learn a different response is always a part of it. However, that might come later because sometimes we need to get that animal's nervous system to a better place. We need them to kind of re-regulate, calm that nervous system down. We might need to bring medications in the interim. And then when they're in a better state to be able to learn something new, then we would come in and teach them new things. And then that obviously brings me on to the use of psychopharmaceutical medications, which is my big love, my big passion. So we do use a number of medication classes to affect emotional state and thereby affect behavior. And some of them are very similar to what we would use in human psychiatry as well. So antidepressants, we use them more as anxiolytic medications, but these medications are becoming so much more commonly used, I think, and we have a few veterinary formulations of them now as well. But it does require knowledge on how to use them. And I think that's a little bit where we're struggling at the moment. So the medications are available, but many vets don't really know how they work and how to use them. So that, again, is where my psychoactive course comes in. But yeah, I've had, honestly, such game-changing results with the support of medication. And just to be really clear, medication alone is never the golden ticket, right? It's not that we're just going to use meds and it's all over and everything is wonderful. All the other things still need to happen, but medication is a big piece. And then, of course, we have our pheromones, our diets, our supplements. So Hannah and I have chatted about those things a lot in the past. But absolutely our Feliway and our Adaptil products, which are brilliant. I use them a lot during my consultations. I use them a lot. I recommend them a lot as part of our treatment plans. Some supplements, not all supplements, I think, you can go quite wrong, or you can spend a lot of money on supplements without actually knowing how they work. But there are some supplements out there that are great. And then, of course, the diet. So we've got fantastic diets such as the Royal Canin Calm diet, and other diets that can be kind of part of that multimodal treatment plan. So yeah, there's a lot that goes into it.
Yes. So I know that you have mentioned Trinity behaviour, and I would like us to talk a little bit more about Trinity behaviour because I know for the listeners and the viewers, you have quite a fantastic opportunity that you'd like to share with us. So please.
Absolutely. So yeah, as I mentioned earlier, so Trinity is kind of my passion project. It's quite different to my bricks and mortar business. So obviously GVC is the bricks and mortar veterinary clinic, and then Trinity Veterinary Behaviour was always intended to be an online global platform that has, so we do offer pet parent consultations as well via Trinity, the vet to vet consults that I mentioned, and then we have a whole bunch of free resources. We're active across all sort of social media platforms and channels, and as soon as I finished my residency, I had all this knowledge in my head from studying for my board exams. And I thought I need to package this and do something with it. So I created Psychoactive, which is essentially an online course, a multi-module online course, which its subtitle is Practical Veterinary Psychopharmacology. So I did initially really create it with the general practitioner in mind. So it goes through, so there are 6 modules, and it goes through everything from sort of what are neurotransmitters, how do neurotransmitters work, how is that important for psychopharmacology, what are some of the pharmacokinetics and pharmacodynamics, without getting too detailed and too bogged down. Some of kind of the different receptors that we might come into contact with, some of our agonist-antagonist profiles. So that's kind of the first module, is setting those basic foundations. The second module talks a lot about what is our ideal patient selection. So how do we even know if this patient is a good candidate for behavior medications? So it's a little bit more of a practical module. There are lots of handouts that go with that. So I've got some downloadable PDFs that accompanies the course. The third module talks all about long-acting or baseline medications. So those would be our SSRIs, our TCAs, monoamine oxidase inhibitors, and a few others. Module 4 then are our short-acting medications. So those are the medications that we would also use in the veterinary clinic as like an event medication or a pre-visit medication. So something that we would give to the animal before they come to the clinic to help them deal with that sort of stressful environment. And obviously our game changer here has been gabapentin in cats. But there are a number of other products on the market as well. So that's module 4. And then module 5 is my absolute favorite module, and it's the longest of all of them. So it's a 3-hour module broken down into small lessons. But it's really that whole, like, how does it all come together and how do we actually use it? So I talk about making choices, about medications, how to start implementing. What happens if you want to stop meds or switch from one med to another? How do I know if the medication is even working? What about serotonin syndrome? Do I need to be worried about that? What about if my patient that's on psychotropics then goes into the clinic to have a general anesthetic? What do we need to think about there? And I also talk about some kind of real case examples about how you would sort of implement the medications. And then the 6th and final module is about diets, pheromones, and supplements. So it's that non-psychopharmaceutical element. And I talk about the products that I really love, the ones that we have evidence-based behind, we have research behind. And then I also do live group Zoom calls. So everybody that's in Psychoactive, we get together once a quarter. People can send in their questions beforehand. And it's literally an opportunity to just get on a Zoom call with me and just talk about cases or questions, or, hey, I don't quite know how to do this, and, that sort of thing. So I love those calls because it really puts me into contact with the people that are interested in this and that are on the course. So yeah, it's kind of my soul's work. I love it. And I just had to get all that information into a course after I studied for my exams. So yeah, that's kind of my signature course, I would say. And then I also have a couple of others. So I mentioned Learn to Speak Dog and Learn to Speak Cat. Those courses are equally for pet owners, but also for veterinary professionals that just want to learn a little bit more about basic dog and cat behavior, because again, we don't get taught a lot about it at vet school. Those are slightly smaller courses. There's about 5 hours of content in each course. They're also split into different modules. We talk a little bit about the foundations of behavior, and then I've got a couple of modules in there that are super practical. So enrichment, again, what are some exercises we can do for behavioral health? I talk about sleep, I talk about calm, all those things that are really important. And then I also mention some of my favorite products that are available, non-prescription products that are available to buy for pet owners, also to buy and implement for their pets. So yeah, those are my Trinity courses. And yeah, we do have a very exciting offer. I don't know whether you want to go ahead or...
I'm fine with you sharing the offers of it's your Psychoactive course.
Yeah.
In Trinity Behavior. So
yeah, thank you. So we have a super exciting offer, and it's actually very much thanks to SVG and SV companies. So the offer is 5 Psychoactive courses completely for free for 5 vets practicing in the UAE. So part of that has been funded by SVG, part of it has been funded by myself, but we want to really provide the opportunity for vets practicing in the UAE to learn more about these medications. And the way that you can avail of this offer is to come and find me on my Instagram account, which is at Trinity Vet Behavior, and DM me in there. So just DM me your name, your email address, and let me know that you would like to have access to one of the free courses. So there are 5 spots available. It is first come, first serve. So if you would like to do this, as soon as you kind of finish listening to this podcast episode, get on your phone and find me on Instagram and DM me your name, your email address, and just say, I'd like to make use of the free psychoactive spot from SVG, and you will be entered into the course free of charge. And then secondary to that, I would also love to offer another 5 courses at a 50% discount. So that would be 50% from the participant and 50% sponsored by myself. So there are essentially 10 spaces available, 5 completely free of charge and 5 at 50%. And the way to avail of the offer is exactly in the same way. Come and find me on Instagram and DM me there.
That is a fantastic opportunity, and I'm sure your DMs are going to be absolutely chock-a-block.
Yeah, I can't wait.
So, yes, that's very exciting. Okay, so let's talk about, I know earlier I had mentioned that you run a fear-free practice and also you follow the zero pain philosophy. So I'd like you to talk a little bit more about that.
So fear-free, if we talk about fear-free first, fear-free is a movement that started probably about 10 years ago in the US. So founded by Dr. Marty Becker, and is all about the idea of improving the patient's experience within the clinic. So there's one study that actually shows that almost 8 out of 10 dogs react fearfully when they come to the veterinary clinic, especially if they're on the consultation table. And fear-free is really a way of reducing that amount of fear, anxiety, and stress in our veterinary patients. So there are a number of different courses that you can take in fear-free. But one of the things you can also do is become a fear-free accredited practice, which is quite a big job. There's quite a lot you have to do to get that. And it's only actually been available outside of the US and Canada for, I think, only about a year. So as soon as I heard that they were doing the certification process outside of the US and Canada, I immediately got in touch with Dr. Becker and I said, we want to do it. And we did that last year. So it essentially means the whole way that the German veterinary clinic is set up is to facilitate just that. So it starts already before the patient comes to the clinic. So there's a lot of things that the caregivers can already do at home to help prepare for that vet visit. It can be pre-visit pharmaceuticals or medications, but it can also be other things. So with cats, we can use pheromones in the cat carriers, for example. We can also give supplements. So there's lots of things that can be done. And then once they arrive at the clinic, it's a question of trying to reduce waiting times as much as possible. We've got a separate waiting area for dogs and for cats so that, there's a minimization of stress there. We use only non-stress handling techniques. We use a lot of props, I guess, in terms of treats and the way that, if they're appropriate, of course, the way that we distract the pets whilst we're examining them, and to try and alleviate a little bit of that anxiety that they might feel. And then the zero pain philosophy kind of links really nicely with our cat-friendly and fear-free principles as well, and is essentially a philosophy that reduces physical pain, and I guess mental and emotional pain as well, if I'm thinking about it now, but is mainly targeted towards physical pain, whether that's acute, either peri or post-operative pain, but also managing chronic pain, which is a massive topic, especially when it comes to behavior as well. So we were accredited last year as well as a zero pain philosophy practice. And again, there are a few things that you have to sort of comply with. There are things you have to show. It does require at least one person in the practice to either be a specialist in behavior medicine or have a certificate in anesthesia and analgesia, which I have both of. So it was quite a kind of a natural progression for us to become a zero pain practice. And also I know the founders of Zero Pain, Matt Gurney and Carl Bradbrook, quite well. So we were quite aligned on all of those things.
That's incredible that you can provide that level of support to patients coming into practice. And I think that's also quite heavily underestimated, the amount of stress that these animals do actually go through from the moment a cat sees the carrier, the moment they're on a consultation table. So it's fantastic that, the thought has gone into that. And it's not just solely practice-based.
Yeah. I think sometimes we can become, as I mentioned earlier, really task-focused. And so that takes away a little bit just from the task, and it helps us focus more on the emotional health and safety of the pets. But we know that a lot of pet parents perceive their pets being anxious at the veterinary clinic, and that stops them from actually taking their pets to the veterinary clinic. So by implementing some of these methods, we can actually safeguard that pets get the veterinary treatment that they need. So I think that's another really important piece there. And then the relationships that you build with the clients along the way, and obviously the way that the team approaches that whole thing. So it really is a whole team approach to doing things a little bit differently. And yeah, in terms of job satisfaction, I mean, I would much rather have a patient cooperate with me when I'm doing something rather than having to force them into having a treatment done.
Absolutely. And taking it back to pet owners, so how do you deal with multi-cat households, which I know we do have quite a lot of multi-cat households. So with regards to behaviour, because we have so many different personalities to deal with.
Yeah.
How do you deal with that?
So it's actually funny you mentioned multi-cat households, because intercat aggression is the most common presentation for feline behaviour cases in my practice. So I think globally, feline house soiling, so peeing and pooping outside of the litter box, is probably the most common thing. But here in the UAE, intercat aggression is the most common thing that we see for sure. And just last week, actually, I had a 2-cat household, a 4-cat household, and an 8-cat household, all in 1 week. And each of those had intercat aggression issues. And you're right. Obviously, the individual sort of personalities and temperaments of the cats play a big role. But the even bigger piece of that is the fact that cats are a non-obligate social species. And that means that they're not dependent on having social relationships with other cats for their survival. So if we think about all the other species that we live with, whether that's dogs or horses or sheep, perhaps, they're all obligate social species. So they all live in these big groups, and their survival is dependent on that social cohesion. And cats are the exception to that rule. And that's why many cats find it quite difficult to share their space and their territory with other cats, especially if they're unknown cats. And so when we get these multi-cat homes where we've got adult cats that have been put together at various stages throughout their life, they can find it really difficult to deal with those sort of intercat social relationships. The way I approach these cases probably varies from individual home to individual home. A lot of it is to do with client education, is to actually allow the owners to understand the whole idea around cats being a non-obligate social species. In some cases, it depends on how severe the aggressive interactions are, but in some cases, we do have to look for other solutions, whether that's, rehoming or maybe having one cat go and live with a family member. So that's happened a few times in my cases. If the homes are big enough, we can have separation between different groups of cats that, get on with each other, but so that we don't have the interactions between the cats that don't get on with each other. So there is a lot of management, or there can be management involved in that. Using psychopharmaceutical medications can be an important piece here as well. And then, again, it depends on how severe the interactions are. So we have some really nice intercat tension guidelines that came out last year, 2024, from the AAFP. And that really breaks things down quite nicely into, are these cats that can coexist in the same space and there are just moments of tension in those relationships? Or are there truly cats that can't even be in the same room with each other without fighting with each other? And so those cases take a different approach. And if we do have cases where there's just, in inverted commas, a little bit of tension, but the cats can coexist, then we start thinking about, well, how do we manage all of the cats in that home? And that brings us back to our pheromones and our diets. So Feliway is something I use a lot of here, and the calm diets. And I jokingly refer to it as herd health. And I know Hannah and I have spoken about this before, but it's essentially treating all the cats in that home, because everyone's going to be affected somehow, whether they're involved in the active sort of tense interactions or not, they're going to be involved to some degree.
Exactly. And I think we were speaking about this previously, about those, the cats that tend to be more aggressive towards others. We tend to focus on them, but you have cats that are a little bit more introverted, let's say, that tend to be overlooked. So I think the idea of herd health is absolutely fantastic, and I think everyone benefits.
Yeah, that's right. It was quite interesting, actually. So a lot of times we can see really clear aggressor-victim relationships. So some cats are the obvious aggressors that instigate the aggressive behaviors. And these cats are usually driven by frustration mainly. So they're very frustrated because they're failing to protect their territory, essentially, because they're trying to drive these other cats out, but they're not succeeding because the other cats remain living in that space. So they can get very frustrated. So that's oftentimes this sort of the aggressor profile. And then the victim cats, they can be much more fearful and anxious. And they're oftentimes the ones that retreat, hiss, they try and get away. And then oftentimes are the recipients of actual physical events. So yeah, you're right. And then, of course, there are the cats that are not the aggressor or the victim, that are just living in the home and that are still affected, like you say, by it. And we all know that cats can also respond to stress through physical health issues such as urinary tract problems or upper respiratory tract problems. So sometimes it'll also come out that way as well.
And can you share with us 3 points that you'd like to tell owners with regards to animal behavior and what can they do in their homes to further support their animals, or outside to support their animals or around others?
Yeah, absolutely. So yeah, I've actually got lots for pet owners. So the first one I think would be, if you feel that your pet is showing a behavior that you just in your gut don't think is right, then please seek help. I think so many pet owners are not quite sure where to go. They're not quite sure, where to find the correct information. They might seek out perhaps a trainer initially, which, could be absolutely the right thing. But if they feel that there's a real sort of behavioral challenge there, then please seek out help sooner rather than later. Because one of the things I hear so often is pet owners coming to me that say, you're our last resort, you're our last hope. And that then becomes quite challenging, not because I don't think I can help them, but because I know that they've been living in a challenging situation for such a long time. And they've tried a lot of things, they've spent a lot of money, and perhaps, there's just something that has been missed that hasn't caused that pet to maybe receive the help that they've needed. So please be early when you seek out help, and just look for professional help out there, whether that's a veterinary behaviorist or maybe a non-veterinary behaviorist initially, but that is willing to refer on to a veterinary behaviorist if they feel that they're stuck in sort of where they're at with their capabilities or possibilities. So that would be the first thing. The second thing is, if you have a young pet that's showing behavioral challenges, don't wait. Because again, one of the things I hear so often is, they'll just grow out of it. They're a puppy and they'll just kind of, things will get better as they get older. And they don't. They oftentimes don't. And that might be because we've got a genetic predisposition, or perhaps we do have an underlying physical health disorder. And in my experience, I usually see, especially dogs, when they're in that adolescence period, so somewhere between 12 and 18 months of age, because that tends to be the time that behavior gets unmanageable for pet owners. So maybe, the puppy's already shown signs of being an anxious puppy, but the owner's been told, don't worry, they'll grow out of it. And now all of a sudden the puppy is no longer a puppy. They're now an adult dog, and everything becomes a little bit more magnified. And that's then when we really get challenges. And also adolescence is a really interesting period from a brain development point of view. So you've got lots of things that go on in the brain during adolescence that make behavior even more difficult to manage. So if you have a young pet, whether it's a dog or a cat, seek help early. Don't wait until things get so bad that you can't manage them. So that would be another one. And then the third one, I think, is, and this is specifically for dog owners, be really mindful of who you allow into your dog's life. So be really mindful when you're choosing trainers, for example, or when you're choosing to work with a professional. Make sure you get lots and lots of information from them. Ask them, what are their methodologies? Ask if you can watch a training session. Make sure that you feel comfortable with the methods that they use. There are so many different approaches out there, and I think not all of them are perhaps beneficial for all of our pets. So finding somebody who is really compassionate, that understands emotional health, that understands body language, that indicates emotional health in both dogs and cats, and just being really mindful about who you let into your dog's life and who you allow to influence your dog, because that's really important for everything, really, for their mental, emotional and physical health going forwards. And on that vein, I would say educate yourself as much as you can on understanding body language and natural behaviors. What's normal for a dog? What's normal for a cat? What are they trying to communicate with us if they look a certain way? Because obviously they can't talk to us, but they communicate so much through their body language. So getting really savvy about that and being really cognizant that dogs and cats can experience emotions and, you know, what that looks like and what those emotions might be. And we always want to keep them in a positive emotional state, and we want to avoid negative emotional states. So understanding what are those emotional states and how can we move them away from negative into positive. So yeah, lots of top tips for owners. But yeah, those would be some of them.
That's fantastic. So yes, definitely owners need to make the most of the amount of research that is out there regarding animal behavior. So thank you very much for that, Dr. Katrin.
Yeah, pleasure.
So can you tell me about a case of yours where you had a patient that came in with quite severe behavioral issues and you were able to support that animal to a point where it improved its quality of life, it improved the owner's quality of life, and overall it was actually it had a much better experience in the veterinary clinic as well.
Yeah.
You have a case like that?
I do. And there's one that comes to mind immediately because it's quite a recent case of mine. It's a lovely dog called Robbie, who lives with his lovely caregiver. And Robbie's probably one of the most anxious dogs I think I've seen throughout my sort of now almost 500 clinical cases. And Robbie's got quite an interesting past, I guess. He's traveled around the world quite a bit. So he came from, I think, a country in Asia, but then they moved to a different country. So there's been quite a lot of, sort of changes in his environment. And when they came to Dubai this time, his anxieties really just kind of peaked. And we think a lot of it was triggered maybe by noises around New Year's Eve. But Robbie would be a dog that just simply could not settle at all. And things got so bad that he was pacing, licking the walls. He was kind of digging at or clawing at furniture, just wasn't able to settle. Nobody was getting any sleep, neither the caregiver nor Robbie. His anxieties would get worse in the evening time, and then he would struggle to sleep. And we really know how important sleep is as well for behavioral health. So it was just quite a sort of a dire situation. And I think the caregiver was quite at her wit's end when she contacted me. And we were able to actually make some really quick wins. So there were some management pieces there. So there are two other dogs that live in the home as well. And the relationship between Robbie and the other two dogs was a little bit fractured as well, just because the other two dogs couldn't understand why he was behaving in the way he was behaving. There were some management pieces in there. So there were a few things we changed and sort of stopped quite quickly, and that helped. But essentially getting Robbie onto a comprehensive psychopharmaceutical plan made things better really, really quickly. And by quickly, I mean within a week or two. And, you know, that moment when the caregiver contacts us and says she slept back in her bed for the first time in like months. So that was lovely. And then she also sent pictures of Robbie playing for the first time in a long time. So when pets get very stressed or anxious, some of those behaviors such as play, those kind of joyful, positive emotional state behaviors suffer. And he hadn't picked up a toy or played with a toy in such a long time. And she sent us a video of Robbie playing with a toy again. And I have to admit that actually brought tears to my eyes, because it's just like, a real quick win and a good outcome. And look, they remain to do very, very well. Some days are better than others. That is the case with mental and emotional health as it is in people. The same goes for dogs. There might be periods that are more triggering where there are more noises outside. So we've started to focus more on how can we drown out noises in the environment. And sometimes you need to adjust medications a little bit. And there are better days and there are not such great days. But overall, she's now sleeping in her bed, and he's never gone back to that state where he was licking the walls and scratching at the furniture and all that sort of thing. So yeah, that's a case that comes to mind immediately, because that was such a welfare issue for me, for the dog and for the owner as well.
Yes, I can imagine that could be quite difficult to see as a pet owner as well.
Yeah.
And also reinforces the importance of knowledge of behaviour, the importance of veterinary psychiatrists such as yourself. So that's absolutely fantastic. Well done, Robbie.
Yeah, you Robbie.
Yay for Robbie. So we're just coming to the end of the talk now, and I wanted to ask if you have 3 things that you'd like to talk to your fellow clinicians about with regards to what would you like them to know more about when it comes to behaviour?
Yeah, that's a great question. I think the first thing is to be mindful that we as vets absolutely have to be involved in these behaviour cases for so many different reasons. I think number one, it falls under our remit of, the oath that we swear when we become vets to do the best for our pets, our patients, and to not be tempted to just send the pet away to another professional because perhaps we're lacking in knowledge. I think, knowing that there are resources out there, there are veterinary behaviourists that can be referred to, I think that's really important. We're not taught a lot of behaviour in vet schools, so I understand it's an area that is a little bit lacking for many of us, certainly. So, yeah, understanding that we as vets definitely have a role to play here, if not, simply to rule out the physical health contributions. And then we have to be cognizant that behaviour takes place in the brain, and the brain is an organ that is also under our remit. So we definitely need to be involved here. So I think that's the first thing. The second thing would be to not be afraid of learning more about psychopharmacology, because although this group of medications can be a little bit daunting in the beginning, once you start using them, once you start to get more comfortable with them, and once you start to see what they can actually do, it is such a game changer, and it's such an important tool to have in our toolkits. And we all know that behavior problems are becoming more and more common, whether that's just because we're diagnosing them more or because there are just more anxious pets on the planet for a number of different reasons. But it's something that we're seeing more and more often. And so I think it's our duty to upskill ourselves and up-level a little bit and just learn a little bit more about these medications. So that would be the second thing. And I think the third thing would be to understand the role that physical health plays in behavior. And we've talked about pain already today. We've talked a little bit about skin disease. So there are some great papers out there that actually link atopic dermatitis with increased levels of fear, anxiety, and aggression, and also the gut-brain axis. I mean, that's like the buzzword at the moment, isn't it? And it's such a big piece. And we know that if the gut isn't healthy, the brain isn't healthy. And if the brain isn't healthy, the gut isn't healthy. So having more understanding around that and how we can influence that as vets, I think.
Well, thank you so much for your time, Dr. Katrin. Thank you for taking the time out to spend with us here at SV Talks and also sharing your insights into animal behaviour and the opportunities that are available in the region. So thank you so much.
My pleasure. Thank you so much for the invitation. Thank you.
Pleasure.